Hello, my name is Kavita Patel, and I work in the White House for Valerie Jarrett, who's a senior advisor to the President. I'm also a physician, which is why I'm here to talk to you today about some of the myths and facts around health insurance reform. So this is an email. I do not think that the government should run health care. It will cost way too much, and it will create a bureaucratic nightmare for patients. Another email said, how are you going to ensure that rationing of services does not occur? A couple of things that I need to point out straight off when I read that. Rationing occurs right now. Health insurance companies, as we speak, sit down and think about what services you can and can't get. Not based on what you should have, not based on the best treatments sometimes, but based on what kind of insurance you have. As for this general notion of the government taking over healthcare, the President has said time and time again, if you like your insurance, if you like the kind of healthcare that you have right now and the plan you have, you can keep it. If you like your doctor, you can keep it. Trust me, I know how important that can be. I've even had to talk about this with my own parents who have often asked me what I think about this plan and this plan. If you like what you have, you can keep it. But the notion that the government will interfere with what you have, it really is laughable.
You know, a lot of people have heard this phrase, socialized medicine. And they say, we don't want government-run health care. We don't want a Canadian-style plan. Nobody's talking about that. We're saying, let's give you a choice. You can choose the private marketplace or this other approach. And I got a letter the other day from a woman. She said, I don't want government-run health care. I don't want socialized medicine. And don't touch my Medicare. And you know, I wanted to say, well, you know, I mean, that's what Medicare is it's a government-run healthcare plan that people are very happy with. But I think that we've been so accustomed to hearing those phrases that sometimes we can't sort out the myth from the reality.
The reality right now is that there is widespread rationing in the form of health insurance, telling you what you can and what you can't have. What we want to see is real reform. We want to make sure that people with pre-existing conditions are not denied coverage. That happens right now as we speak. People get kicked out of their insurance plans because they have increased medical costs and they're deemed to be unworthy of coverage. We need to make sure that those people like you and me, also have access in case we do get sick, and in case we do lose our jobs, and in case we do need to change from one employer to another. We have to have that security. So I ask you to help us make sure that the reality and the myths are explained. Please forward this video and some of the other videos that you'll see on whitehouse.gov to your friends, to your neighbors. Share them with your doctors. Share them with people who you know will benefit from understanding a little bit more about the myths and realities.
Hi, my name is Melody Barnes, and I'm the director of the Domestic Policy Council. You know, for President Obama, health care is a deeply moral issue. It's something he cares a great deal about, and he believes part of his service to the American people is getting it done and getting it done right. And that's why, for those of us who work with him day in and day out on this legislation, we've been really surprised about some of the wild rumors that we've heard flying around. One of the worst that I've heard is that in some way this bill is going to force euthanasia. That's pretty hard to believe, but in fact, we recently heard that a member of Congress said the following.
Republicans have a better solution that won't put the government in charge of people's health care, that will make sure we bring down the cost of health care for all Americans, and that ensures affordable access for all Americans, and is pro-life because it will not put seniors in a position of being put to death by their government.
We've seen these antics too many times before when people trying to scare the public when we're trying to get something really important done. And that's why I was pleased when President Obama recently went to the AARP and did a teleconference and was asked this question. I think the moderator, Mike Cuthbert, got it about right.
Mr. President, she mentioned, not in her question but in her preview, that she's talking about Section 1232, the infamous page 425, which is being read as mandatory end-of-life care advice and counseling from Medicare. As I read the bill, it's saying that Medicare will, for the first time, cover consultation about end-of-life care, and that they will not pay for such a consultation more than once every 5 years. This is being read as saying every 5 years you'll be told how you can die.
Well, that would be kind of morbid.
Now, I know sometimes, talking to my own family, that the legislative lingo can be a little dense, sometimes tough to get through. But if you want to go to the legislation and look up the provision in the bill, it's actually Section 1233. And when you go there, you'll find exactly what President Obama has said, that this provision will allow people to access information about getting a living will. There's absolutely nothing mandatory about this. It actually empowers people to have caring conversations with their family members and to have conversations with their doctors where they can get accurate information if they choose to do so. It empowers you to make choices about your healthcare future. It also says that Medicare will reimburse doctors if they have those kinds of conversations. Again, nothing mandatory, nothing scary, nothing that's being described by those who are saying that the bill actually forces euthanasia. So if you want information, go to whitehouse.gov. Also, feel free to share this video with your friends and neighbors so everyone has the facts and isn't relying on fiction. We want this debate to be carried out on the merits. Thank you so much for your help.
My name is Matt Flavin. I serve as the White House Director of Veterans and Wounded Warrior Policy. I'm a veteran myself, having served in Bosnia, Iraq, and Afghanistan. Recently, we've received a spate of emails that expresses concern over the effect of the national health reform effort and its effect on VA healthcare. I'm here to tell you, quite simply, that if you are eligible for VA healthcare, you will remain eligible. There is no impact on VA healthcare. The President's budget expands access to the VA to an additional 500,000 veterans who were previously denied coverage.
For their service and sacrifice, warm words of thanks from a grateful nation are more than warranted, but they aren't nearly enough. We also owe our veterans the care they were promised and the benefits that they have earned. We have a sacred trust with those who wear the uniform of the United States of America. It's a commitment that begins in enlistment, and it must never end.
We've also received emails here at the White House that are concerned that they'll be penalized under the VA healthcare system for not meeting the individual mandate requirement. This is also not true. The current House legislation exempts those covered under the VA from having to meet that mandate. So veterans, please be comforted in the fact that your healthcare will not change under health reform efforts. There is no effect.
Hello, I'm Christina Romer. I'm chair of the Council of Economic Advisors here at the White House. And I wanted to talk about, again, one of the myths that's been swirling around the healthcare debate. And that has to do with what healthcare reform will mean for small businesses. And I'll give you an example. We get lots of comments on the website. And one said, I own a small business, and the proposed healthcare reform would make it impossible for me to hire new employees and might force me out of business. The current healthcare system does not work well for small businesses. Just to give you a fact, a small business typically pays about 18% more for comparable coverage for its workers than a big firm. Right? And that puts them at a competitive disadvantage. Either it means they have to have lower profits and less ability to grow and expand their businesses, or it means their workers get lower take-home wages. And that isn't good, obviously, for their workers or for the small business wanting to hire the very best people. One of the ways that we see this playing out is that small businesses provide health insurance much less often than big businesses. Probably only about half of the businesses with fewer than 9 employees actually provide health insurance, whereas you get to a firm 200, 300 employees, it's almost 100% of them provide coverage. The important thing is that healthcare reform is absolutely aimed at easing those burdens for small firms. So for example, all of the proposals talk about a health insurance exchange where either small businesses or individuals can go and buy health insurance on much better terms, right? The plans have a tax credit for small businesses to help them provide health insurance for their workers, to reward them for doing the right thing by their employees. You know, some of the proposals have what we call an employer responsibility requirement. That's aimed at medium and big firms and saying if we call it pay or play. If you don't provide health insurance, there's a penalty. Well, the bills as they're working their way through Congress all have an exemption for small firms. For example, one version exempts any firm with fewer than 25 employees. They wouldn't face any of those requirements. And that's about 91% of firms. And of course, the other 9%, the vast majority of them are already providing health insurance. The facts are very clear. The system doesn't work for small businesses now, and reform is very much aimed at easing the burdens, making it easier for this crucial sector of our economy. Small businesses account for a big part of job creation, a big part of innovation. We want to help them, and that's why the reform proposals are aimed at lessening their burdens. We hope you'll help us to get the word out so that we get the right information to people. I'd also encourage you to come to whitehouse.gov, the website. You'll be able to see our report, read about small businesses and what healthcare reform will mean to them. I hope you'll also read another Council of Economic Advisors report where we looked more generally at the benefits to the whole economy, to the deficit, to economic growth from healthcare reform. And so that report will be there as well.
Hi, my name is Bob Kocher. I work at the White House National Economic Council where I work on health insurance reform. I'm an internal medicine doctor by background, and I used to care for patients before coming to this job. I'd like to take a minute and talk about one of the emails that we've gotten related to healthcare reform and dispel some myths that people may perceive. The email says the following: convince me that my current Medicare benefits will not be cut or eliminated in any way, shape, or form, and that my healthcare costs will not increase but be reduced, and that my healthcare coverage will be increased along with the quality of care that I now receive through Medicare. First, you will have lower drug costs. Right now in the Medicare program, when you reach the point at which the Part D plans do not cover the drugs, you have to pay the full price. Under insurance reform, you will pay lower prices for those pills that you take. There'll be no co-pays or costs to get the preventative and needed care you need to prevent cancers, get the needed immunization, and that will make it easier for you to maintain your health. You'll have more doctors to choose from. We're going to expand the workforce so that it will be easier to get appointments with your primary care doctor, specialty doctors, and that's true in both urban areas as well as rural areas of America. We're improving the information that your doctor gets so that when you go to the doctor, you will not have to continuously fill out the same forms and paperwork, which frustrates you and you worry you get wrong. They'll know what drugs you're taking, so you don't have to write them down every time and bring them in. They'll know what you're allergic to, they'll know what doctors you saw, and they'll know what needs to go on with your conditions because they'll have the right information that they need to take care of you.
Let me also address, I think, a misperception that's been out there, that somehow there is any discussion on Capitol Hill about reducing Medicare benefits. Nobody is talking about reducing Medicare benefits. Medicare benefits are there because people contributed into a system. It works. We don't want to change it. What we do want is to eliminate some of the waste that is being paid for out of the Medicare Trust Fund that could be used more effectively to cover more people and to strengthen the system.
Please tell your friends the facts related to health insurance reform, and for more information, go to whitehouse.gov. Thank you.
Hi, I'm Linda Douglas. I'm the Communications Director for the White House Office of Health Reform. And one of my jobs is to keep track of all the disinformation that's out there about health insurance reform. And there are a lot of very deceiving headlines out there right now, such as this one. Take a look at this one. This one says, uncovered video. Obama explains how his health care plan will eliminate private insurance. Well, nothing could be farther from the truth. You know, the people who always try to scare people whenever you try to bring them health insurance reform are at it again. And they're taking sentences and phrases out of context and cobbling them together to leave a very false impression. The truth is that the president has been talking to the American people a lot about health insurance reform and what is at stake for them. So what happens is that because he's talking to the American people so much, there are people out there with a computer and a lot of free time, and they take a phrase here and there, they simply cherry pick and put it together and make it sound like he's saying something that he didn't really say. Now, for example, here's a clip that they probably won't show you.
Here's a guarantee that I've made. If you have insurance that you like, then you will be able to keep that insurance. If you've got a doctor that you like, you will be able to keep your doctor. Nobody is trying to change what works in the system. We are trying to change what doesn't work in the system.
And here's another one.
The public plan, I think, is an important tool to discipline insurance companies. What we've said is, under our proposal, let's have a system the same way that federal employees do, same way that members of Congress do, where we call it an exchange, but you can call it a marketplace, where essentially you've got a whole bunch of different plans. If you like your plan and you like your doctor, you won't have to do a thing. You keep your plan. You keep your doctor. If your employer is providing you good health insurance, terrific. We're not going to mess with it.
During the August congressional recess, the members of Congress are going to be back where the health insurance reform debate matters most, and that is in neighborhoods and communities where people are struggling with high health care costs, where people are facing unfair insurance regulations that deny them the health care that they need, where people are really seeking some kind of stability and security that will let them know that there will always be health care available for their families. The country's been waiting for decades for action, and we are not going to let them down this time. So it's very important for you to have the facts. The clip that you just saw is available on www.whitehouse.gov, as are many of the president's statements and speeches. You should take a look at that, see what the president is really saying about health insurance reform and how it affects your life. Thanks very much for joining me.